as a child, I have been brought up in a Muslim family in rural parts of Africa, um, where my parents worked. And there was always this big value in the house that you treat everyone as you would like to treat yourself. And I think it became quite obvious to me as I grew up how this was practiced at home. That's where probably the roots of compassion started with me. And that was probably mixed with other things. That can't be the only reason that I went into the whole field of medicine.
Compassion for me is beyond empathy. Empathy, for me, practically is, can I put myself in your shoes to understand where you come from? Compassion is, can I put myself in your shoes and feel what you feel? And that's, for me, is a whole world of difference. So compassion is feeling the other person, not just understanding where they're coming from, not just doing the logic of, well, okay, I can see where you are, I understand you're sick, I understand you're in pain, but can I feel the extent of the pain? Can I feel the extent of your discomfort? Can I situate myself to that extent to actually feel what you're going through? And that for me is compassion. You know, all the issues of quality we talk about, you know, patient-centeredness, equity, you know, they're fundamentally heart issues. And I tell myself and colleagues that you need to be authentic in the quality space. You cannot deny your faith, you cannot deny your beliefs, you can't deny it and pretend that patient-centeredness, pretend that, you know, the common humanness is just a piece of English language. You have to feel it. It sounds wishy-washy if you detach it from the human person. So it's challenging to speak to it as if it's a theory, as if it's an academic piece of theory. No, you must let people authentically relate to it and let them find areas in their lives and other spheres of their lives where compassion has kicked in, where love of neighbor has kicked in. And words like that, we shouldn't be shy about it because it's a people issue. It's not a technical skill, it's a people issue. And people shy away from it. But if it's presented as a people issue, it has nothing to do with, forget about Muslim, Christian, professor. At the bottom line, how would you want to be treated? And people get stuck in answering that. But we shouldn't be shy about naming it. It's about loving the guy next door. It's about being selfless. You know, it's about being a good person, whatever good means. But we need to use those words. We need to not let people be shy of it. You know, we need to. If not, people dissociate in their minds the technical work from the heart work. And we need to bring the two together. It is what it is. You cannot do compassion or quality without your heart. It's just not possible. You know, we started out working and these were not the questions we asked ourselves. It was very technical. You do the numbers, you do the work, and it's about the work. And then as we matured in the space, it ceased to be about the work. You see the real impact that you do on people's lives. And it's humbling. From the faith, it's a humbling experience to realize that I have that much power in my hand as a health worker, and I want to be paid as a health worker. I will make the diagnosis, I will treat, I'll make suggestions, people will listen to it, lives will change. I mean, that's absolutely raw power. But my faith humbles me to realize that that's a gift. It's a gift of God. You know, and then my faith tells me, hey, you know, let your God in heaven take the credit for what you do. So all these things are humbling. It allows me to do my work without wondering whether people are going to appreciate what I do or not, whether people are going to acknowledge me or not. I just get out and do my best. And when somebody says, God bless you, I'm like, God, done it. They've acknowledged that there's something bigger than myself. You come to the point where you realize that it's not about you. It's not about you. It's much bigger than I am. And I'm just grateful that I can let somebody say thank you and say, God bless you, and make sure that, yeah, there is something bigger than myself. And for me, that's what keeps me going. So whether it's at midnight, whatever it is, I am just one of those in the vineyard of the Lord, and I do my best.
I come from a Muslim faith, and if you study the Muslim faith, actually, compassion is a very integral part and pillar of the whole religion itself. So it's not only about the value of religion, but it is ingrained in the whole religion or the practice of religion as itself. In fact, now that you talk about it, each time we start anything, to read the Quran or read any piece of the Quran, we always start with the name of Allah. And the first word is the compassionate. And then the second word is the merciful. And if that's the kind of emphasis sort of on it, I think it sort of runs through the sort of whole religion itself. And I'm sure, now looking at hindsight, that my family was driven by this. And then they inculcated in their children the whole concept. That's one part of this. So the second part is, how does it influence my work? I think it's come to a point where it's so much part of me that I really don't consider it religious anymore. I think it's a human duty. It's my duty as a human being to be compassionate. I can't see it otherwise. And then if I say I draw the inspiration from my religion, yes, that is true. But I think it has a much broader implication now.
At the root of all the faiths, it's exactly the same. There's no conflict of faith. There's no conflict of faith in the efforts to do good, whichever way we understand good to be, to meet the expectations of the patient or the other. It's exactly the same. Whether it's a Muslim, a Buddhist, whoever we meet on the ward, there's never a conflict faith-wise. There's never a conflict in terms of how we care for the patients, how we manage them. You know, what happens is the separation of faith in the secular world and what we do, only to realize down the line that all these issues of quality, of the shared humanity, it's all in faith. But at the end of the day, it sits in our guts. It sits in everybody's gut, what is right and what is appropriate. Yes, we rationalize it from a secular perspective. Why should I go the extra mile? Nobody's paying me for this. Why it's time to get off my shift. Why should I stay another hour? Let the nurse coming in do the work. You know, we rationalize it. But I dare say when we leave after the rationalization, it hits us all. It's hit me enough time to know that don't waste your energy to rationalize. Just do what your gut tells you and then move on.
It's a very, very interesting question because I've been asked this all my life. I have now worked for an organization that is of a Christian faith for about 24 years. And I believe that it's got to do with a lot of understanding, a lot of tolerance, and above all, shared values and vision. At no point in time in these 24 years, there has been a conflict at this particular level, which is what matters to me. And that is the cause for which I work. That is preventing blindness. I have never had any conflict, neither spiritually nor ethically, with the organization ever.
As we matured in the work and we matured in faith, there's a calm, there's a humility that goes with the work that we do. There's an appreciation, of the dignity of the person you're managing, the dignity of the person you're treating. They're different only insofar as their skill set, but in the eyes of the Lord, they're exactly the same. And I'm motivated to treat them as I would want myself to be treated. But it's about, how do I make sure I respect the dignity of the person standing in front of me? The other thing is, the Bible tells you a time will come and Jesus will say, we'll be telling, Lord, I know you, Lord, I did this for you. And he will ask you, when I was thirsty, did you give me water to drink? And I will ask him, when did you tell me you were thirsty? And he will say, you know that guy who passed you 5 days ago, who asked you for water and you dismissed him? That was me. So to put it frankly, we're probably totally scared that the guy in front of you just could be Jesus. What if this was the one Jesus sent? What if this was Jesus himself? And it's gone beyond doing it because of the expectation that, hey, you're going to pass the test. Now it's just become a way of life, a perspective one has, a framework one uses in managing and doing what we do all the time. You see, the shared humanity is the dignity of the human person. We were all created in the image and likeness of God. He created us male, he created us female. But we're all fundamentally created in the image and likeness. That is the shared humanity. Classic example. There were days, again, when one was in the clinical space, we were just dead tired. You could barely open your eyes and you're walking around emergency. And we knew that other hospitals had shut down. This is the only hospital that is working. We knew our shift was over. But you ask yourself, if you leave, who is going to do what needs to be done? At the end of the day, for me, in those very difficult situations, they are very difficult and trying situations. There's risk of infection, there's risk of many things. And you ask yourself, why am I doing this? Why would I put myself and my family and everybody in jeopardy? But at the end of the day, your heart kicks in. Your heart actually kicks in and you're like, you know what? Yes, I could get infected. Yes, I'm dead tired. Yes, I could leave and nobody would hold it against me. But you know what? Hey, let me do my best. Let me just do my best and know that I did my best. And whether you're an atheist, whether you're a Christian or Muslim, the heart kicks in and keeps you there.